Okay, good morning, everyone. My name is Anna Kiley. I work with the Montana Public Health Training Center, and it is my pleasure this morning to introduce Dr. Heather Voorhees, Associate Professor of Interpersonal Health Communication at the University of Montana. With 15 years of experience as both a journalist and a healthcare communication manager, Heather brings deep real world, insight to her work on illness identity, health disclosure, and health misinformation. And Heather will do much more introduction here in just a moment. So please join me in welcoming Dr. Voorhees.
And the crowd goes wild over Zoom, right? Good morning, everybody. Thank you for being here. Hopefully, everyone can see the screen. Hopefully, everyone can hear me. You will see that there's a QR code on your screen right now. There's going to be some interactive features, some questions I'm going to throw to the audience, some little mini quizzes as we go through. So if you want to participate in those, all you have to do is scan that QR code or go to menti.com and enter that code that you see there on the screen. I'll show this again later. So if you miss it this time, don't worry, it'll come back. But let's go ahead and get started this morning talking about everyone's favorite topic, health misinformation. So thank you for that introduction, Anna. But just to kind of give some background on kind of who I am and why I'm here speaking with you this morning. As Anna said, I am an associate professor at the University of Montana. I joined in August of 2020, which was a very fun time to move across the country and start a brand new teaching job. So before then, I came to Montana by way of a postdoctoral fellowship at the Center for Health Communication at UT Austin. That was a wonderful year of my life. I got my PhD from University of Nebraska, go Big Red, and my master's from the University of Minnesota Twin Cities. I am a Minnesotan, born and bred. Some of you are also on this call. Welcome. And what's important about that is that before I joined academia, this is my third career. So I served in some other roles before I came to the professorship. Most notably, I actually started out life as a newspaper journalist. I was a magazine editor and a newspaper journalist for 6 years. So I was in small towns, working for bi-weekly newspapers, weekly papers, daily papers, really getting a feel for community and really learning how to talk to community folks and listen to them and kind of keep your ear on the pulse of the community, which is what you as public health professionals do. I also have experience after that. I became an internal communication manager for Fairview Health Services, which is the largest health system in the Twin Cities. At the time, we had 7 hospitals, 40 some clinics, 20,000 providers. I mean, it was a very large system, and we were a small internal communications team of 7. So I have lots of experience working side by side with healthcare professionals, particularly communicating to healthcare professionals and to patients as well. So as noted, what I do now is I not only teach my classes, but I research interpersonal health communication, so communicating 2-on-2, 1-on-1 small groups, specifically in the realm of chronic health and chronic illness, illness identity disclosure. And recently, I really started looking into health misinformation. I actually developed a class on it for undergraduates here at the University of Montana. I became really, really interested in that in 2020, 2021 for obvious reasons, right? And so it wasn't something I started researching, but I became very fascinated about it. And so my career is taking a very interesting sort of pivot here. So I'm here today to share some things that I have learned, to share some evidence-based ideas. I've broken this presentation down into kind of 4 chunks. So first, we're going to start with some foundational definitions. I think it's really important to level set so that we all kind of have the same vocabulary going forward. Then I'm going to talk about why health misinformation spreads. There's very good reasons why rumors and myths and straight up lies spread throughout a community. I'm going to give you some tips on how to identify misinformation, both face-to-face, in person, and online, because that's how it spreads. And then I'm going to end with some strategies for counteracting misinformation, which is your job, right? So again, this presentation is tailored toward public health professionals, people who are in the community and communicating with a lot of people at once. But I think even if that's not your role, there's still definitely things that you can take and learn from this. So everyone is welcome, but just kind of know that's sort of the angle that I'm taking. So again, there will be a couple of interactive portions of the presentation. If you want to participate in those, you can scan this QR code or you can open a new window on menti.com and enter that code there. Also, if you have questions along the way, please feel free to type those in the Zoom chat. Kayla and Anna will be monitoring those chats, and so we can kind of stop and take a break for questions every once in a while. I do talk very fast. It is something I am working on. So I understand if this is coming at you fast and furious. I'm just really excited about this topic and I'm really excited to share stuff with you today. So I do also want to start that I don't have all of the answers. Research is actually really, really new on health misinformation, and we don't really have a consensus on magic bullet, pardon the term, ways to fight it or to address it. So we understand a little bit about why it spreads. We understand why people believe it, but we're still really struggling with the best strategies to combat it. So I don't have all of the answers for you. I do have some tips and some basic information that will help you think about this in a different way, because my belief is if you understand what you're trying to do, you're going to look at it from a different perspective, and that will open up new windows for you. So that's my goal today, is kind of get you more familiar with this, give you some hands-on tips, but by no means am I an expert, and by no means do I have a one-size-fits-all solution. So why don't we start here by looking at the Menti. I had the Menti up open, the little poll right now, and so we can go and look at some of the results. I asked just a few couple questions just to kind of start us off. How much do you agree with health misinformation about various topics is common in my community? Seems like we're all kind of struggling with that, and we all think that there's lots of misinformation going around, and you're probably correct. Health misinformation is hurting my community. Yeah, that's a pretty high 4.3 out of 5. So we're all concerned about that. And we understand that there are real ramifications to health misinformation. And it looks like our confidence is not super high, 2.5 out of 5 on feeling confident addressing misinformation either face to face or in writing. You know what? I'm also not super confident all of the time because it can feel very, very intimidating. And it feels like we're fighting one person wars, right? So I fully understand that. And I'm right in the trenches with you. I get this. I don't think you're alone by any means. And so I just wanted to kind of level set and just sort of take the pulse, if you will, of how we're all feeling today. So thank you for participating there. So as we start, I also do want to point out that there is a difference between misinformation, so false information, and false beliefs. Okay, and it's really important to think about this the right way. There is misinformation, and we'll define that in just a second. And sometimes that causes misbeliefs, false beliefs, misperception, but not always. Okay. Sometimes people can receive all of the correct information, but still arrive at false beliefs or inaccurate beliefs. And that's due to a lot of different things. There's biases in how we listen to and perceive information. There's cognitive issues. Maybe we don't really know how to parse out things, or science literacy might be low. There's just misinterpretation of correct information. So I want to start by saying you can be doing everything right, and there still may be false beliefs within your community. And that feels very difficult to hear, and it feels very frustrating, and I get that. But the world is not yours to say below. Right? So today we're going to talk about specifically misinformation, not necessarily false beliefs, but the misinformation that very commonly does lead to false beliefs. Okay, so let me give you some foundational terms. Perhaps you've heard these before, but I think it's important to clarify. There's misinformation. This is the term that we typically hear. And this simply means information that is simply incorrect, right? So it's inaccurate, it's unreliable. The people disseminating it maybe don't pay attention to it. They don't maybe fact check it. They don't necessarily pay attention to the effect that it's having. So this can be innocuous. This can be simple, basic, just information that's wrong, right? Like, when you have a cold, you're supposed to down vitamin C. That's a myth. That's misinformation. Vitamin C can help prevent the cold. But once you have a cold, it doesn't actually do a whole lot. Um, the background on that myth is fascinating. I could spend 2 hours talking about that myth alone. But misinformation is simply just, inaccurate, right? People spread it because they are not really paying attention. They're not really spreading it for malicious reasons. There's something called malinformation, and this is a little different flavor. This is information that's incorrect, but it stems from the truth. So there's a kernel of truth in there, but it's either exaggerated or distorted in a way that misleads and causes potential harm. So in this instance, it's spread intentionally. Someone is taking something that seems true and that perhaps is, and they're kind of tweaking it a little bit. And they're doing this in a way that can cause potential harm. So think about maybe someone posting a photo that is accurate. It's a real photo, but it's from 10 years ago. And they're saying that this is from yesterday, right? Or thinking about posting a photo that's been slightly photoshopped. That's malinformation. The person knows that they are doing this and they're spreading it anyway. They're not just not paying attention, they're doing it with an intention. And the danger here is that there's, again, that little kernel of truth there. So it can be really hard to parse out. Last, we have perhaps the most dangerous form, and this is disinformation. This is information that is just flat out false, and it's deliberately spread in order to deceive you. The person who is spreading it, the person who created it, they know that it is false, and they are spreading it with an intention to gain something or to take something from you. This information is intentional, it's manipulative, and it distorts reality. Think about scammers who are trying to scare you into purchasing their protein shake or their supplement. They're very intentionally giving you false information in order to try to get something from you. Okay. Today, we're going to focus mostly on misinformation and malinformation, but you will definitely see examples of disinformation in here as well. Okay. So just kind of understand that there's different sort of levels and they do different things and they have different amounts of harm. Misinformation is harmful, but not nearly as harmful as disinformation or malinformation. Okay, so we'll use the term misinformation, but kind of know that there's different flavors here. So what do I mean by health misinformation? What qualifies as a piece of health mal, or disinformation? There's certain characteristics that misinformation around health have in common. Number one, health mal and disinformation tends to be negative. We tend to try to play on negative emotions like fear or anger and sadness. This is very intentional because when our brains are flooded with emotion, our brains actually work differently. Our cognitive skills are impeded. We think about things differently when we're scared, right? That fight or flight instinct kicks in, and suddenly we're not as able to parse out the truth anymore. We're not as able to think as critically as we once did. So misinformation, malinformation, especially around health, tends to try to be emotional and it tends to try to be negative. Okay. So again, you're not going to see a lot of health misinformation that's really happy or that's really like, yay, we solved the measles crisis. You're not going to see a lot of that. It's going to be negative. It's going to try to scare you. It's going to try to make you worried. Okay. To try to scramble those brain synapses. It's also often based on personal stories. You'll hear this a lot. You will get anecdotes tied to, well, my cousin tried the vaccine and he got really sick. We try to tie these back to personal narratives. And why do we do that? Because humans are storytellers and we love stories and they hit differently than statistics. You're not going to see a lot of health misinformation that gives you a lot of information or statistics or cites a lot of sources. It's going to be, well, I heard from so and so, or think about your loved ones. Didn't they have XYZ? So it tends to be story based, and those stories tend to try to stir up emotion, and those emotions tend to be negative. Lastly, health misinformation, a lot of times, especially now, but since time immemorial, has been trying to use anti-science narratives. They're trying to create an us versus them narrative. You'll see this a lot. What they don't want you to know. Or my favorite is those stupid ads of like, doctors hate it when you say this. They're trying to create this. There's a them and they're hiding things from you, and there's an us and we know the truth. So a lot of times we'll try to rip down experts. We're seeing that rampantly, right? That is what we see right now is ramping down, building mistrust in science, building mistrust in government, building mistrust in institutions, us versus them. Okay. A lot of times it'll be subtle too. My favorite is the I'm just asking questions, right? No, you're not. You're trying to build mistrust. You're trying to plant that seed of doubt and then provide your answer as the correct answer. Okay, so think about these aspects. Think about some of the health rumors and misinformation you've probably heard in your community. They probably fill some of these buckets. Okay, so let's take a little quiz just for fun. Who do you think is most likely to believe health misinformation? When we think of health information, we maybe have an idea in our head of the people that tend to fall for it. Okay. So there was a study in 2021 of more than 900 people, and they were aged 40 to 80 years old. They were social media users for an average about 5 days a week, about 30 to 60 minutes a day. So researchers asked them questions about popular misinformation about statins, HPV vaccines, and cancer. And what this particular study found is that there are certain factors that make people more likely to listen to and to believe health misinformation. So, which of these things do you think make a person more likely to believe health misinformation? And what we're going to do here is I'm going to open up that Menti, so you can go and you can vote. There are three of these factors that make someone more likely to both interact with and to believe misinformation. So there's older age, there's preference for alternative medicine, so things like supplements or aromatherapy or things that we call alternative. That's just kind of a catch-all. More frequent social media usage, less education or health literacy, higher incomes, or distrust of the healthcare system. There's three of these things that these researchers found tend to make people more likely to listen to and to believe misinformation. So let's watch our poll here. Let's see what we think. So you can choose up to three, and there's no shame. I'm not grading you. You're not going to get kicked out of the class. Just think about, when you think about people who, again, fall for, and I hate to use that term because very intelligent people have been fooled by misinformation. What do you tend to think of? So it looks like we're kind of aligned with less education or less health literacy, distrust of the healthcare system, more frequent social media use. Yeah, those feel right, right? Those things feel like these types of people might be more likely to believe health misinformation. So let's see if we are correct. The correct answers are boom, 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 boom. All right, so we picked two of them. Preference for alternative medicine was actually one factor that made people more likely to believe health misinformation. Less education and health literacy, which y'all chose, and distrust of the healthcare system. So these seem to make sense, right? If you have less education, if you have less health literacy, you're less able to think critically about, does this message seem reliable? Who can I trust, right? And that makes sense. Preference for alternative medicine was really interesting because that doesn't necessarily go hand in hand with trust of the healthcare system. But sometimes those two things are related. And the problem is when people have a preference for alternative medicine, there's a lot of scammers out there that are trying to take advantage of that. So they are directly targeting those folks, right? Oh, you want to try sound baths to, heal your symptoms. Great. There's nothing wrong with that, right? Anyone can try any kind of medicines that they want, but there's a whole body of misinformation scammers that are specifically targeting those folks. So they tend to be targeted more. And then, of course, distrust of the healthcare system, because again, that health misinformation tends to build that us versus them mentality. And if you're already sort of distrusting the system, you're going to buy into that. So nice work. Good job. Staying alive. I love it. So let's look at, now that we kind of understand the levels, if you will, of health misinformation, let's look at why it spreads. This is perhaps the most frustrating thing. Some of us will see a piece of misinformation and we'll go, oh my God, of course that's fake. Why would someone believe this? There's very good reasons why misinformation spreads, both person to person and online. So the big three reasons that misinformation is so rampant and spreads so quickly is number one, uncertainty. Humans crave certainty. We want to know what to expect. We want to know what others are doing. We want to know the right thing to choose. We're very uncomfortable with uncertainty. But the problem is there's so much that we don't know about the human body. We have made leaps and bounds in medical science in the past 50, 15, 5 years. But so much of medical science is still, let's try and see what works. And that's okay, right? The human body is incredibly complex. And so we're still learning more and more every day. In fact, science is the process of trying to disprove what we already know, right? If we thought we had a cure for something and then we just stopped with that, we might be wrong. The whole point of science is to test our things and to try to make sure that they are what we think they are. But in the meantime, that can look like scientists don't know what they're doing, right? How many times do you see a study that comes out that says coffee is great for heart health? Just kidding, coffee is bad for you. Just kidding, now coffee is healthy. It can be really frustrating. What are you doing, scientists? Why can't you agree? Well, because that's the scientific process, is to try to constantly test something again and again and again and again over a long amount of time to make sure we come to a consensus. No one study does science make. I love saying that to my undergrads. No one study does science make. No one study will ever tell you anything. You have to go out and keep studying and keep proving and keep disproving. There is something called the basic law of rumors. This was developed by Allport and Postman in 1947. This is a super old concept, but it's very, very relevant today. Okay. The idea here is that you can tell how many rumors are floating around about a topic based on the importance of the subject to the people who are, in the community, and you multiply that by the ambiguity of the evidence that we have. And that will give you the number of rumors circulating within a network. So think about that. How important is health? So important. I'm a biased because I study health. It's the most important thing. Health is everything. So of course, we're going to try to find the truth. We're going to try to pay attention to this. We're going to try to understand health. But then how ambiguous is health? Oh my gosh, if you've ever used Google to try to look up your symptoms, well, Google will tell you everything you have is cancer and you're dying and you better, make plans for the end. Because there's still just so much we don't know, right? A symptom can mean one of 27 different things. And so there's a lot of ambiguity around health, but it's really important. And so that alone makes health rife for rumors, for myths, for misinformation, because we all want to crave that certainty. We all also want a desire for control. So what happens when we're uncertain is that we feel out of control, and humans don't like that. We like to be in charge of our fate. We like to be in charge of our destiny. And when we're not, we get scared. And so we go looking for answers. That uncertainty makes us desire control. Okay, so this leaves us open to messages that make it seem like our health is within our control. Are you experiencing poor sleep? Don't you worry. You can just take this supplement and everything's going to be fine. We want answers, and we want to feel like we're doing something to again give ourselves that sense of certainty and control. Okay. So many commercials I see are like, are you experiencing XYZ? Just take this one simple pill. It's never that easy. It's never that easy, but it's a tempting message because we want to feel like we're doing something active. Okay. Lastly, and this is the big one, mistrust. We are social animals. Humans are pack animals, and we trust the people around us. We need to survive. So we have an inherent trust of the people that we know, as well as the people that we think know us best. There are people that we don't trust, right? Think about your out group. Think about people who aren't like you and who don't have your best interest at heart. We trust them less than our family members, than our friends, than people who seem like us. Okay, and we'll look at that in just another second. Um, but people who seem like they have something in common with us, that's our pack. And we tend to trust them more than people who are on the outside. So if you take a group of people in the community who perhaps, maybe they're pretty well educated, maybe they're middle class, maybe there's a lot that they don't know about health because it's not their specialty. And you get someone coming in from DC who has a bunch of PhDs behind their name and spends their life in a lab, that person's not like me. Why should I trust them? They don't know what my life is like. And so it's really difficult to know who to trust, especially if sometimes your friends and family members are the ones sending you this misinformation. You tend to trust those people. So I want to take a moment here to talk specifically about my Montana public health folks, because we also face a very special problem with mistrust here in Montana. Because think about the culture that we are living in and think about the groups of people that we're dealing with and how they may have a particular mistrust of us as people who are, part of the government or probably, part of groups that are trying to have their best interests at heart. In Montana, we have a very large Native American population, and they have historically been really mistreated by the government and by scholars. Quite frankly, academia does not have a glowing history of treating Native Americans quite well, right? There are very good reasons why the Native American population mistrusts, in particular, the government. I mean, here are just some examples. As late as 1973 to 1976, the Indian Health Service performed more than 3,000 involuntary sterilizations. Oh, that's a misprint on it's sterilizations of Native American women, right? That wasn't that long ago. And so these things are still happening. Today, the United States spends 4 times more on federal health or a federal prisoner's health than on healthcare for an average Native American individual. Since 2016, the IHS has denied payment on outside care for people seeking healthcare through the IHS service for more than 500,000 patients. That's $2 billion worth of care that these folks were denied because the government would not allow for them to go outside the system. There are very real reasons why those populations mistrust the government and anyone perceived to be with the government, right? But it's not just Native Americans. Think about rural mistrust. Here in Montana, we are mostly rural. I am a rural girl myself. I was a farm girl, born and raised, and I saw a lot of this firsthand. Remember the farm crisis of the 80s? Some of you were not old enough to see that, but it hit my family personally. Banks foreclosed on more than 250,000 family farms during the economic crisis of the 1980s, which extended into the 1990s. Farmers were mistrusting the banks. They were mistrusting the government. They were mistrusting everyone because they felt like no one was helping them. Think about how rural populations have been shrinking and how that has meant less funding to rural healthcare. Rising costs of healthcare across the board, rising costs of technology have meant that rural hospitals have closed in crazy numbers, right? Since 2010 alone, more than 105 rural hospitals have closed across the country. 100 rural hospitals have closed in the past 15, 16 years. 64% of Montana's rural hospitals have either sustained losses of services, and 25% are at risk of closing or converting within a couple of years. So rural people feel forgotten, and rightfully so. Let's talk about big pharma. Let's talk about how they used and abused people, specifically in rural areas, when it came to opioids. I could talk for a whole semester about opioid and the opioid crisis and how there were maleficent people behind that. And there were bad actors who were very intentionally targeting rural Americans, and rural Americans knew that. So rural Americans don't feel great about the government and the healthcare system either. They also don't feel great about researchers. When does the university reach out to rural folks? When we need them to participate in one of our studies, right? Are we there on a regular basis? Not always. Now that's changing. We're making more of an effort to get into those communities, but they typically only see this when we want something from them. So, especially in Montana, there are really critical cultural reasons why, even though we are trying to serve this population, they don't necessarily trust that we have their best interest at heart. Okay. It's not just that, though. It's again, all humans are pack animals. Here's a really interesting example that sums this up beautifully. There was a 2012 study of people in an online cancer support group, and it asked them where they found information about cancer treatments, about cancer symptoms, things like that. 83%, most of the information that they heard from non-medical sources were actually rumors, were unfounded. They were not evidence tested. They were, try lemon juice to help heal your whatever. They were, old wives' tales or just straight up rumors or misinformation. Okay. So most of the information they are not getting directly from their doctor is not correct. That's disturbing. 85% of the rumors that these folks heard came from friends or family, and mainly from face-to-face interactions. Now, this was in 2012, so I bet those numbers will have changed, but we're still communicating with people we know and trust. And sometimes they can spread the misinformation. Okay? 85% of the misinformation came from trusted loved ones. Confidence in the rumors was not based on the person's expertise. It was based on how much we trust them personally. Let that sink in. It wasn't even about the evidence. It was about the person sharing the evidence. If my husband, who I trust innately, comes to me and says, "Oh, I heard this thing and I think you should maybe try this supplement," my brain is more likely to trust him. Now, in our household, I question everything because that's my job. So everything he tells me, I'm like, actually, let's examine that. And it frustrates him to no end. But people that we know and trust, we're giving them the benefit of that doubt, no matter what the information is. So keep that in mind. Mistrust is dangerous, and we often don't have public trust on our sides. So we're already kind of fighting a losing battle. Here's a fascinating study that will hit for our Montanans especially. Interpersonal communication is really, really powerful, because if we don't trust official sources, we turn to our neighbors, we turn to our family, we turn to our friends. This was a study from 2013, and it asked about fire safety and who you would trust to keep you updated with, fire information and whether or not, you need to pack up and move or whatever. When considering the probability of a wildfire, talking to one's neighbors was just as impactful as being informed by a wildfire expert. Information gets passed between a lot of sources, and that trust is crucial. And who do we trust? We trust the people who look like us, who talk like us, who have similar backgrounds as us, and who seem to have our best interests at heart. That can make it feel like right away, we as public health professors and professionals, we're coming from the outside. And so our job is particularly difficult. Anna or Kayla, are there any questions that we can address right now in the chat? I'm happy to, if there are.
Sure. Yeah, there was a couple of comments and questions back when we were talking a bit about kind of in the last section of your presentation. One with respect to frustration with nutrition science and how the recommendations change so frequently that
Yes.
folks can get frustrated.
Yes.
And then there was a question, where is the tipping point for confirmation bias? So when does that come
Mm,
into play in
yeah.
this conversation?
Yeah. Confirmation bias is the idea that we tend to pay more attention to and give more credence to ideas that already confirm what we were already thinking. Um, the problem is when that gets really strong, then we start actually just blocking out ideas that seem to contradict what we already know. And that goes back to this idea of control and certainty. When you have been using chicken soup as a cure all for the common cold for 40 years and it works for you, and you know that that's going to make you feel better, and someone comes along and says, actually, there's no scientific studies that say that soup it's not really factual, it's just an old wives tale, you immediately tune that out because no, it works for me. Shut up, get away with your study, right? Um, so we're working against that because people have things that they feel that they already know. They have people that they feel like they already trust. And we're coming in again from the outside, not looking or sounding like those people, telling them things that they don't want to hear. So the problem too is that we start to put ourselves in that echo chamber, in that bubble. And so when confirmation bias gets stronger and stronger, now we're only following those influencers that tell us what we want to hear. We're only watching those news stories that seem to confirm that we already know what's going on, right? And so we're pushing out all those outside sources. So it's difficult to combat. And I would say you can't combat it. And I'll talk about this in a little bit. Simply telling people that they're wrong and you're right is never going to work. You have to ease your way in. You have to become one of those people that looks like and sounds like and talks like those folks. And you have to build that underlying sense of trust to introduce those ideas in a very gentle manner. It's a long-term process and it's very frustrating because it feels like there's always public health crises popping up that you got to attend to. But building that low level trust over time is so crucial in order to getting people to even hear your message, nonetheless believe it. So, yeah, confirmation bias is very real. And yes, nutritional misinformation is, yes. And in my class, in my undergrad class, we talk about the history of the food pyramid, which is let's do a class on food pyramid. Anna, sign me up. I'll teach a class on the food pyramid and how it came to be. And there's kind of shady stuff going on with the food pyramid, right? There's lobbyists, there's all kinds of things that work. What I always tell people is I don't think you should believe anyone 100%, right? I am not here to tell you the government is right 100% all the time, always believe them, particularly now. But what I will tell people is that you should think critically about every single piece of information you hear. And I try to give people the skills to do that. And we'll talk about that in that next section. So, nutritionists, dietitians, I feel you. I hear you. Um, you're doing God's work out there.
Thanks
All
so
right.
much, Heather. There's some more questions coming in. I think maybe we'll save them and I'll try to maybe consolidate some questions if they're similar. And then at the next kind of natural break, we can address some additional questions.
Absolutely. Absolutely.
Great.
Thank you so
Thank
much.
you.
So, now that we kind of know uh, why health misinformation spreads, why there's this mistrust, why we crave certainty, let's talk about how to identify it. Because not only is it frustrating to understand kind of what this is and why people are believing it, health misinformation can be insidious and it can be tricky and it can wiggle its way in there. It's not always as obvious as you think it is. So, I'm going to give you some tips on how to be skeptical, how to be critical, what to look for when something seems too good to be true. Okay. And again, like we just talked about, I encourage everyone to be critical on everything. I don't take anything at face value these days. It's a kind of a stressful way to live. But once you start kind of thinking about what is this person trying to do? What are they trying to get me to do? It kind of opens up a whole new way of thinking about health and about other things too. So, number one, if you're trying to understand if a health rumor or piece of misinformation or a social media post or a news story is correct, critique the source. This is perhaps the easiest thing you can do. Okay. Social media makes it really, really easy to click and share information. And people often do without paying close attention to what they're sharing. So I want you to stop and to think about what this is, okay? If it's a social media post, do you know and trust the original poster? Not just the person who sent it to you, but the person who created this to begin with. If this is an email or a text that you get, are you trusting the person who sent it to you? And are you trusting the person they got it from? And we'll talk about the source in just a second. But think about where this is coming from. If there is a website that you are reading or that you get sent to, is it a reputable website? Is it something like .gov, .edu, .org, things like that? Now, again, those tend to be more reputable and trustworthy. Not necessarily always, but is it a .com website that tells you that we have the miracle cure for your cold sores? Or is it a study on a .edu website? There is a difference in qualities of information out there. So critique that source. If this is a product, does the person selling it have any credentials? Okay. You would be amazed how many people are trying to sell you protein powders. I don't, there's a really interesting reason why protein is the new fad. There's a very good reason behind it. Nutritionists, I see you. But think about who is selling you this product. Should Mel Robbins, the podcaster, be selling me protein? Probably not. What are her credentials? They're nothing to do with food or health or diets, right? So if this is a product, if this is a something that is being sold, think about the source. What does this person know about anything, in particular about the product they are trying to sell? Okay, so critique the source. This seems obvious, but it takes time and it takes energy to do that. And oftentimes it just feels good to just click and share and click and share. But really be careful about what you're clicking on and what you're reading. Okay, so again, I want you to pay attention to if this is an email, if this is, again, a text, if this is a social media post, look for links back to a credible source and look for multiple sources of information. So, oh my gosh, look at this cool thing that I found. Here's a link to a .com website that sells you something. Okay, great. But is that really the most credible source of information? Every good piece of information will cite their sources. It was drilled into me when I was in my PhD program. Cite your sources. Don't just tell me I heard a thing about eating more protein is great. Go buy some protein powder. Cite my source. There's so many stories out there that will say a new study found, and then they don't show you the study. Do you trust that person to be interpreting the study correctly? Or do you want to go and read that study yourself? Okay. Every credible source will link back to where they found that information. If it doesn't, that's a red flag. So here's a really good example. This was a story in the New York Times from several years ago, and it was talking about a new study that looked for AI and its promise in helping in physicians in patient-provider communications. And you can see here the link, a 2014 study in the British Medical Journal, and when you click that, you go right to the abstract of this study. Yes, this is what we like to see. So if you're seeing links or if you're seeing, stuff or information, new study found that kids have more cavities if they watch more TV. Cool. Show me that study because I want to look at it myself. If it doesn't even give you that opportunity, red flag. I also want you to read past the headline. Headlines are fun. They're sexy. As a newspaper reporter, I put a lot of importance in writing a good headline. But wow, can they be misleading? Here is a really great example. And I'm not making this up. I found this online, and when I did, I thought jackpot, because this is a perfect example of why you can't just read the headline. Here is an actual post that I found on Changing America. Changing America is it's supposed to be a nonpartisan newspaper website that's supposed to give you information about Congress. It's a newsletter that comes out and it's by The Hill. Okay, so it's supposed to be nonpartisan. Great, nonpartisan, great. The Hill, I trust them. They're a pretty decent source of information. This is one of those stories that they put on in 2022. Drinking hot coffee may increase risk of esophageal cancer. Oh no, how frightening. I'm so scared. Let me quick share this with every coffee drinker I know. Nope, take a second. Because if you'll just read past the headline, you will see that not even the subhead agrees with the headline. The headline tells you that drinking coffee will increase your risk of cancer. The subhead says there is no evidence supporting a causal effect of coffee consumption on any major cancer type. The two headlines don't even agree with each other. Okay. All you have to do is read both of them, read past the headline, and you start thinking, what? Just for your elucidation, because I know you're all curious now. I actually read this study and it published a journal. It was in a journal published in Clinical Nutrition, which is a pretty decent journal. And it looked at 580,000 people in the UK and Finland. Great. But what was this study about? Okay. They were looking at genetics. They weren't looking at coffee consumption and how it caused esophageal cancer. They were looking, this was a genetic study. And what they happened to find is when they asked people, how often did you drink coffee? What was the temperature of your coffee? What they actually found had nothing to do with the coffee at all. They found that they think what might be happening is that people who drink super hot beverages more often are at an increased risk of throat damage, which may lead them to be more at risk for throat cancer. It had nothing to do with genetics. It had nothing to do with the coffee. It had everything to do with the temperature and the frequency that they were drinking it. And even then, it didn't cause cancer. It was one factor. So, what a journey that was through the article, right? You don't get that if you just read the headline. So, do your due diligence, read the story. What is it trying to say? Okay. If you're only going to look at the headline, sure. Let me give you some tips on how to do that. Look for disease mongering. Disease mongering is a term where we make something really, really serious and medical out of something that really isn't that bad of a problem. Okay. It widens the boundaries of an illness in order to grow the market for those who want to treat or sell you something. So, for example, baldness is not a disease. It is something that happens to folks as we age. Okay. Low bone density is not osteoporosis. They are two different things. So, again, think about widening those boundaries. Think of medicalization of normal states. Hey, I hate to break this to you. We're all going to get wrinkles. It's just the way that it goes. Okay. It's not a medical condition. It's not something you can cure. It's something that happens. The vast majority of people who ovulate are going to go through menopause. It's just going to happen. It's not a disease. It's not an illness. It's a natural bodily function. Okay. We expand the definition to include a larger population. Think about testosterone deficiency. What? That's not an illness, right? For the vast majority of people, that's just a state that happens. For some people, it can be a very serious issue, but for a lot of people, it's not. So let's not treat them all the same. One of my favorites is restless leg syndrome. This was really, really big in the 90s and early 2000s. It's an actual syndrome. This is an actual condition that occurs to about 1% to 2% of the population. But back in the 90s and 2000s, you'd see commercials on every minute of every day. Do you have restless leg syndrome? Do you have a hard time relaxing at night? Are you nervous when you go to bed? Do you have problems calming down? Yeah. Okay, I guess we all have restless leg syndrome. No, we don't. 1% of the population has it. So beware of disease mongering, turning non-medical normal conditions into illnesses that need to be cured. Okay. Also look for sensationalism. This can be easier to spot, but sometimes not. Sometimes it's tricky. Look for telltale signs of urgency. Okay. Exaggerated language. My favorite is suffer. Do you suffer from toenail fungus? Well, I mean, am I suffering? That's debatable. Anything that's called a miracle is lying to you. Everything that tells you that it can do anything with 100% accuracy is lying to you. Science will never tell you anything 100%. I can't tell you 100% that the sun's going to rise tomorrow. I can tell you 99.999% that it will. But any good scientist will never tell you anything 100%. That's the point of science. Think about shocking or scary. Look at TV computer craze is giving kids cancer. Right? Think about bold, italic words. Think about exclamation points. Exclamation points have no place in headlines. As a former journalist, I can tell you definitively anything with an exclamation point is suspect. An inflated sense of urgency. Act now. Don't wait. Don't hesitate. 5 things to stop doing today. You've all seen those, right? Anything that gets you hyped up. It is trying to make you nervous. It is trying to make you scared. It is trying to build that sense of fear. Also, look for something called accelerated rationalism. This is a term I just came in contact with a couple of weeks ago. This is when people present a ton of information super, super quickly so that you kind of gloss over the details and you don't have time to critically think about the actual message. And therefore, you're like, well, these all kind of make sense together. So I guess this message makes sense. They're trying to scramble your brain. They're trying to give you not enough time to look for things like this. Accelerated rationalism. They're forcing you to make a decision on the spot, and they're doing it by blasting you with info. Okay. Some of these things are easier to recognize than others, but these are some of these are really obvious. Some of these scams are really they're screaming at you, quite literally. Okay, building that sense of urgency, building that sense of fear. Okay. I also want to draw your attention to visuals. We are a visual species. We like to see things, we like to watch things. A lot of us are visual learners. So, especially on social media, you'll see a lot of visualizations of things. And again, if they're presented really quickly and you don't really get in there and think about stuff, you can easily be tricked. Your brain will gloss over something. Here's a really good example of how we can distort information. These two graphs tell you the same exact information. They tell you a rise of something from 2 to 10 between the years of 1990 and 1994. But look at how they're presenting the information. One of them is much more, oh my gosh, look at that increase. Oh gosh, right? The one on the left is, it feels scarier. The increase is bigger. Oh, it's, oh my gosh, but it's not, right? So think about how graphs are being presented to you. Think about how the information is being presented. Here's a really good example from USA Today, which is not immune to misinformation, by the way. This is a really good one because the numbers aren't necessarily incorrect, but look at how they place them. Spinal injuries are the first thing your eye is going to look at. It's the least likely thing of all of these injuries to happen to your child, but it's the scariest and it's the most severe. And so they put it at the top. It's the first thing your eye is drawn to. Oh my God, my kid is going to suffer a spinal injury. So if you're just quickly engaging with this, you're not going to give yourself time to really think critically about what's there. Again, this is not wrong information, but the way that they present it can be misleading. Here's my favorite one because this is just funny. The numbers don't even add up to 100. What is happening with this pie chart? This is bonkers. Like, this is not the right way to present this information. A pie chart should always total up to 100%. So I don't even really know what's going on with this graph here. But if you look at it, your brain makes a split decision and you interpret it in a way that might not be correct. All right. So these are some tips to think about misinformation, to think about how to identify it. So now I want to give you a chance to try it. So if you are in the Mentimeter, you can go back there. If you're not yet, you can scan this QR code and you can go there. It'll take you to, I have an example there of a fake social media post. And I want you to just engage with it, just look at it for a few seconds, and you can type right in there. What do you notice that is problematic about this social media post? What kind of jumps out at you as something that might be concerning to you as you are viewing this? Okay, and I will share this so that we can all sort of see that here in live time. Yes, they're hiding the truth! Exclamation point. Who's they? Who is they? I'm assuming it's a doctor because we got a guy in a mask there, but I don't know who that guy is. Billing that us versus them. Yes. Sense of urgency. Yes. This is shocking. Bold voice with the little wee alarm on the top. Yes. Breaking news. Yes. Selling a cure. Effective at curing. Yes, absolutely. Tons of info. There's no source here. Right? Where am I linking to? What study? What scientists? How have we discovered this? Show me your source. All the exclamation points. Just so many. You guys, the more exclamation points, the less trustworthy this is. Saying the information is going away. Yes, share this before it's deleted, creating that sense of urgency. It's scaring you, right? Um, they don't want you to know about it. They're going to censor me. Hurry up before it goes away. 1,000 times more effective, right? Big pharma, yes. Sensationalism, yes, 100%. So this one is kind of obvious, right? This one is, I created this to kind of be a sort of jokey, but this stuff is out there. This is not uncommon to see. But yes, so the tells are there. Okay, let's try this with a little bit different of a flavor because misinformation isn't just social media posts. Sometimes there are things that look like legitimate news posts that can also serve as misinformation. So let's try this next one. So here is a fake news article about a new study that tells us something about a new cure for something. Miracle drug frees us from dandruff. Oh, this lady is so happy her dandruff is being cured. What do we find perhaps problematic? What kind of jumps out at you? What would you notice? What would you dig deeper into? Miracle, yes. Miracle is always, that's always a scam. That's always a red flag. Study done by the farm company. Nice work. Who is conducting this study? Is it in their best interest to tell you that their cure works? Yep. Yes. Who is the participant in this study? Cockroaches. Do cockroaches get dandruff? I'm not an entomologist. I don't think they do. Dandruff, yes, dandruff is not a serious problem. It is a biological function. We do not need a cure, a miracle to free us from it. It does not cite its source. Yes, 100%. Completely cured. Yes, it cured all 12 cockroaches. The drug was 100% effective. Yes, wonderful. Great work. Read past the headline. Now, that lady is so lovely. You want to trust her. But, this isn't really a thing, right? Using a photo of a lady when it's a cockroach study. I love the emojis that you all are using in your responses. That makes me happy. Yes. Wonderful. Wonderful. So this one is a little less obvious, right? But with just a modicum of looking into this, of doing some due diligence, of thinking about what am I looking at and what is this, what's actually going on here? Digging into it shows you that this is not probably something that you should be trusting or especially sharing with other people. Okay. So nice work, everybody. Good job. You passed the test. Before we move on to addressing misinformation, I want to just check with Anna and Kayla if there's any maybe themes of questions coming up, anything I can answer before we sort of jump in.
Thanks. I do think that there are some themes emerging, certainly, and some of them are questions about addressing some of this. So maybe I'll
Great.
save some of those for our next break in the event that you maybe are going to answer these. There have been some questions, though, about like parasociality and Instagram
Mm,
folks or TikTok and influencers,
yeah.
particularly with young people that are
Yep.
following them and consider them to be friends, even though they've never met the person. So you mentioned that a little bit. And then there's also been some themes of questions surrounding AI, both in terms of is it being used to help create this content that's mis or disinformation? And then also, are you noticing or hearing about whether there's also AI contributors as like fake people interacting with these posts? So, in things like
Mm,
likes and shares and
oh, yeah.
comments, like are those even potentially not actual human beings
Yeah.
interacting?
I mean, social media changed the game, and then AI changed the game again. And that's part of the reason that research is still catching up with how to address misinformation. We don't have a one size fits all cure because it comes at you from so many different ways, in so many different forms, from so many different people. I mean, the point about influencers and parasocial relationships, the whole point of those folks is to make it seem like you should trust them, that they are your friend, they are just like you. And oh, by the way, will you give me something in return? Right? But there's a reason they're called influencers and not just friends. They're influencing you to do something or to buy something. So again, think about the source. If you're gonna, buy Jennifer Aniston, whatever she's selling these days, Oh, I like her. She seems like a nice lady. That's the kind of bottled water she drinks. I'll drink that too. I mean, part of that is just basics of advertising and marketing, and that's been around forever, right? But online is kind of taking it to a new level because we're starting to build these intimate relationships with these people that we'll never actually meet in person. So again, there it's really critical to just really, really examine the source. Do you trust this person to have your best interest at heart? What are they gaining from this? What might they have to benefit from your interaction or your engagement with them? What do they want from you? Right? Everyone wants something from everyone all the time. Your friends and family tend to want things like love and affection, and online people tend to want things like money and clicks. So I don't have a great answer for especially AI, which is just, I mean, we're seeing our government use AI to manipulate images now. And I don't know the answer to that. I'm very confident I will always have a job studying this stuff because I don't think that it's going to go away anytime soon. So I don't know is the answer to that. But yeah, I mean, it's something to be concerned about for sure. So I want to point out now, and I think I'm sharing the right screen that I have. Yes, beautiful. Okay, so I want to kind of move now into giving you some, not just tips on how to acknowledge or identify misinformation, but how to address them. And so again, some of these are going to be from a larger scale, communicating with a lot of people at once sort of aspect, but a lot of them are also things that just any folks can do with their friends and family and loved ones. Okay, so again, these are not instant fixes. These are not the be all end all. They won't always work for every situation, but these are some evidence-based ways that we can start to kind of address this. Okay, so what I want to start off with telling you is that ignore your instincts to just say, oh my gosh, that's totally fake, and here's the right answer. Information isn't always the best weapon against misinformation. In fact, it often isn't. Okay, we may be tempted to respond to every piece of misinformation we see with correct facts. Actually, nope, it's this. Yes, that's our first instinct, but that doesn't always work, and I'll show you why. Maintaining an even keel is a slow and effective way to build trust, and that doesn't happen overnight. And so, if your first instinct is to just get out there and try to bust every single myth that you're hearing with the truth, that's probably not going to work. So instead, what I'll show you in a second is that this is a slow burn. This is a slow build, and building that trust over time is a critical part of this. Okay, so why can't I just tell people the truth? It's very frustrating, especially when you hear information that to you is very obviously incorrect. Well, there's something called psychological reactance, which you've probably heard of. This is the idea that when a person feels that they are being threatened, a threat to their freedom, of either freedom of beliefs or freedom of behavior, when they feel that that freedom is threatened, they feel icky. It's an unpleasant arousal. There's a sense of I don't like this. Okay, it stirs something up in us. And this is universal. This is Western culture beyond the world. This is just a human concept here. Is when we feel like someone is trying to control us, because again, we want control, we feel gross. And there's three different ways that we deal with this unpleasantness. We can either A, deride the source of the information, so insult the credibility of the authority. They don't know what they're talking about. Or you can challenge their authority. What do you know anyway? You don't know anything. Okay. Or we can reassess the situation and its importance. Well, that doesn't jive with what I heard, but who cares? It's really not that big of a deal. We can just kind of decide to maybe just let it go. We haven't really dealt with that feeling of ickiness, but we're just kind of saying, it's not that big of a deal. I have other things to deal with. Or perhaps the most dangerous reaction is something called the boomerang effect. And this is when we double down. When we feel that someone is threatening us and our freedom to choose or to believe or to act, we can actually want to do the opposite. If anyone out there has ever raised a toddler, you are very familiar with the boomerang effect. You should eat your peas. I don't want to. Well, you should. Well, now I'm definitely not going to do it. right? The more you push, the more likely someone is to feel gross about it. And sometimes that might backfire and they might actually go do the opposite. I'm not going to eat this broccoli. I'm going to go and eat chocolate. So there, right? We all have that instinct within them. As communicators, we really, really want to avoid enacting that sense of psychological reactance and that sense of the boomerang effect. Okay. So simply just telling people you're wrong and here's why is not going to work. Instead, we have to be clever. We have to come in from the side. We have to present this information in a gentle, happy package that doesn't seem to be a threat. Okay? It's not as sexy as those misinformation ads that we saw before, but it can work over time. So let me give you some ideas on how to do that. As public health professionals, you play a really important role in addressing and contrasting health information, right? You're constantly fighting misinformation, both in messaging and when you're out in the community, when you're talking person to person. So what you can do is first and foremost, maintaining that consistent, non-emotional, non-judgmental voice. Be consistent in your vocabulary and in the tone. And this isn't just around a public health or misinformation crisis. This is all the time. Within your work, if you're talking with people face to face, or if you are putting out press releases, if you're on social media, maintain that tone. You want people to know exactly how you're going to sound when you talk to them. That's calming to people. It's that sense of certainty. They feel good knowing how you're going to react. Okay. Use a consistent tone, use consistent vocabulary, use conversational language. Don't talk down to people because people don't like that, right? It creates that us versus them, but also kind of come down to their level, right? You don't have to use terms like that icky flu bug that's going around, but you don't necessarily need to call it, staphylococcal meningitis every time. So find that happy medium of where your audience is at and use that consistent tone and vocabulary. It's really important as professionals to recognize that health is emotional, but you don't want to shame people for their feelings. The last thing you want to do is make someone feel dumb or bad for believing something that someone that they trust told them. We all fall for misinformation, all of us, myself included. All of us do. And so this is not a matter of intelligence. This is a matter of being a human being. And you want to encourage people to not be scared to admit when they maybe fell for something, to not be scared of bringing you something and say, I heard this. Is this right? It seems right. You want to be that trusted, non judgmental source that's not going to deride people for maybe believing something that isn't true. Part of this too is also keeping an ear out for your community concerns. Listen to your community. What's important to you might not be on the top of their radar. And if you're constantly coming at them with messages about, I don't know, the flu shot, when they're currently worried about water safety, you're going to look like you're not listening to them. Your tone is going to be off, right? So get in the community. You are in the community. What are people worried about? What are they talking about? Those should be the things that you are also talking about, even if they're not necessarily the number one priority for your department at the time. It's really important to have your ear to the ground. Okay. By doing that, you're creating and maintaining that sense of similarity between yourself and your organization and your audience. Remember, we trust people who look like us, who sound like us, who live where we live, who share our beliefs. Make sure your communications are indicating that, right? You live in your communities. You know these people. You know the hot goss from around town, right? You live here. You're worried about the things that they're worried about. So in your communications, again, both interpersonally or if you're, doing large scale messaging, think about how you can create that sense of similarity. I'm one of you. I live here. I also have a family or pets or a grandma or grandchildren, whatever. Imply that you share their values. I, as a Montanan, also value independence. I also want our communities to be a safe place to live, right? Again, acknowledge that it can be confusing. You're not up here with your eye on the prize protecting these folks. You are one of these folks. You live where they live. You hear the things that they hear. You're worried about the things that they're worried about. And it's okay to acknowledge that. And it's okay to acknowledge that sometimes you get worried about that too. Yeah, I'm also scared about measles. I'm also concerned about water safety, right? I'm one of you building that sense. And that's not shady because you are one of them, right? So bringing up those similarities because people tend to trust people that are more similar to them, for better or for worse. You also have a really interesting role in that you have an opportunity to help demystify science and research. A lot of people don't trust what they don't understand, and a lot of people haven't been trained on scientific literacy. They don't know how to read a research study. They don't know what to look for. They don't know what makes a research study good or bad. You have an opportunity to help educate them and demystify these things, right? So, one thing you can do is add nuance to the argument. It's really, really tempting for us to come back and be like, all the studies say that you need to get the flu shot. Hard stop, end of conversation. It's okay to acknowledge that sometimes research is gray, that sometimes we don't have 100% of the answers. It's okay to acknowledge that, right? The flu shot isn't 100% effective, and it's okay to say that. That doesn't hurt your argument. That actually helps your argument. Because if you say, like, if you don't get the flu shot, you're definitely going to get sick this year, that's not necessarily true. And then what happens if someone doesn't get the flu shot and they don't get sick? Well, now your message is not trustworthy. It's okay to acknowledge that science is a little messy sometimes. That's okay. You can gently point out the flaws of studies, right? Talk about, actually, I read this study and it does make sense. However, what I took from it was, they were working on cockroaches instead of on humans. So personally, I don't think that's a great study. So it's okay to walk people through this and kind of lead by example. Again, excuse me, it's okay to be transparent. Okay. I recently read a really interesting op-ed in the New York Times that discussed the debate over fluoride in drinking water. And it's really, really easy to scoff and say, of course, drinking water is safe. Of course, chlorine is not going to hurt you. Of course, RFK is totally wrong when he says that we should dechlorinize water. However, there are some shoddy studies out there that demonstrate that incredibly high levels of fluoride have been in some populations linked to lower IQ. Um, these studies were not great, right? There's also a lot of rat studies out there on fluoride. It's okay to acknowledge, yeah, there are studies out there that say that, right? You can be transparent about that and then gently sort of redirect and teach people what the flaws of those studies were. You don't have to come down and say you're 100% wrong because, again, sometimes these arguments aren't 100% wrong. Sometimes there is that kernel of truth. And you're going to build that trust if you acknowledge that rather than just shutting out your ears. Also, you have an opportunity to direct people to reliable information. There are really good sources out there that you and that everyone has access to. You don't have to be working at a university to have access to academic research. There's good sources out there that you can share with people. Role model that, right? Oh, yes, I saw this post. Here's actually something that I think you should read in concert with that. Or here's a really good study that I found interesting and really well done. You have the power to do that and to get those good sources out into the community. Okay. Um, and this again builds that consistency that you're always going to be in the habit of showing people where to find alternate information. You're coming at that confirmation bias kind of from the side, right? Yeah, I understand why you believe that. Here's a different view that I think is also very trustworthy. And you're gently giving them, you're leading that horse to that water. You can't make the horse drink. Trust me, I've tried. But you can gently sort of guide them. Okay. What I think is also really interesting too is that instead of just giving people information, sometimes you want to just help people understand their own way of thinking. Rather than attempting to debunk information, you can simply help that person explore why they believe what they believe. Now, this takes skill, and it's hard to do this in a non-judgmental tone, but there are things that you can ask someone to get them thinking on their own about why this piece of information seems credible to them. Why do you believe that raw milk is the best be all end all? Why do you believe that? right? And again, it takes a lot of skill and a lot of practice to come at this from a way that's not judgmental. But things like, oh, where did you hear this? Simply asking someone to describe their source of information sometimes triggers, well, I saw it in a Facebook page that was sent to me by my cousin Jim. Oh, and it gives them that moment of pause to think about their sources, right? Other questions you can ask, oh, have you seen this other places too? People like to say, I do my own research. That's one of my pet peeves. You didn't do the scientific method. But what they mean is that they're looking into things. They're collecting information. So you ask them, oh, where else have you seen this? Oh, well, I heard it on a podcast. Oh, okay. Well, I wonder, does the podcast, like, do they have stuff to buy? I wonder if they have things that you can purchase this podcast. Or simply asking someone, yeah, that seems right. Do you think there might be something else going on? Like starting the conversation. And that also leads you to say, sure, I have some really good sources that I use on this. Do you mind if I share them with you? Because if the person says, I'm doing my own research, I'm really interested in getting to the bottom of the story, that's a great time for you to say, wonderful, I have some more information that you might think is really interesting, that really adds to this conversation. So again, you're not judging people. You're not telling them that they're wrong. You're not even necessarily giving them information. You're walking them through their rationale. And simply by being forced to stop and consider, where did I hear this? Why do I believe this? Sometimes that can help people start to think on their own without threatening their freedom of why something rings to them. Okay. Sometimes we do actually want to just provide alternate information, and it is in our best interest to stop a rumor or a misinformation, mistruth where it starts. What I will tell you is that simply discrediting the misinformation is not going to help you. You need to actually provide an alternate explanation. Okay. Um, there is a concept out there that if you simply tell someone that something they heard is incorrect, it creates a gap in their memory. Because what you're saying is, well, wait a second, that's wrong. Well, then what goes there instead? So instead of just saying, don't listen to that piece of information, you have to give them something to fill that gap. Okay. Otherwise, we're just going to revert back to that misinformation. So providing an alternate explanation can help people replace the incorrect information that they initially had. So here's a really good example. Shutting down someone by just saying, science shows that raw milk is dangerous. That's not really persuasive, okay? Because it often comes by as sort of judgmental, and then you're just telling me that something's wrong. Okay, well, now I have this whole, well, what is correct? You're leaving people hanging, and their brains want something to fill that gap. So instead, you could say something like, you're right, the danger posed by raw milk is minor for most people, but there is a danger, especially for people who are immunocompromised and for children. Pasteurized milk is safe because the process kills pathogens that cause illness. Now, I haven't actually seen credible evidence of the real benefits to raw milk. So instead of just saying you're wrong, give them other pieces of correct information to chew on. Give them something to replace the information you are taking away. Okay? One way to do this is a process called transformative explanations. I'm going to walk you through this process. Now, this often works best when you're face to face with someone having a conversation, but it can be used in mass communications as well. This process comes out of risk and crisis communication. So we tend to see this employed when something is actually happening that needs addressing right now, but it can also be used within the community on an ongoing basis to sort of gently ease people into reconsidering their sources and re-examining sources of health misinformation. Okay. So the process here is that you're not necessarily telling people they're wrong, but you're taking a phenomenon that is hard to understand or believe, because again, we crave certainty, and we are transforming an inadequate explanation about that into a more explicit, better one. So you're taking a subject that is really confusing. You're acknowledging that there's some solutions out there, but they're not really good or they're not good enough. Instead, here's some better information. Not that you're wrong, but that here's some better information. Okay. This process has a couple of different steps, and I'll walk you through these step by step and I'll give you an example. So number one, you want to state the lay view. You want to acknowledge the misinformation that you have heard. This primes people to understand what you're talking about, and it shows them that you also have heard this information, right? You're one of the community members. You have seen this misinformation. You know it's out there. Number two, and this is crucial, acknowledge its apparent correctness. Again, this is where that transparency and where that compromise comes in. It's okay to say, I get why this seems right. I understand that. You're building that sense of transparency and that sense of trust, that sense of I'm one of you. I get why this information seems correct. Once you've done that, you want to demonstrate, though, why it's not adequate. You want to give some sort of argument, perhaps against it, or some sort of conflicting information. Why is this explanation, which seems to make sense, actually not correct? You want to present a more orthodox, a better explanation. So again, we're filling in that gap that we're leaving with a better information, not necessarily the correct information, but a better explanation. And then you want to demonstrate why that better information is more correct. Okay? This looks like a lot. Let me walk you through an example. And again, this can be used in writing. This can be used face-to-face. This can be used in a lot of different ways. But let me give you an example. Let's say your best friend is visiting you and they ask to use their bathroom. And she snoops a little bit and she notices that your deodorant contains aluminum. And she rushes out of the bathroom to tell you, you need to throw away your deodorant immediately because everyone knows that aluminum causes breast cancer. Everyone knows that. Now, you might feel grateful for her caring about your health. That's very kind. But you feel like you maybe need to start correcting this piece of misinformation, because it is a piece of misinformation. Here's how we do that. Number one, state the lay view. I've heard that too. I've heard that aluminum causes cancer. Okay? Just easy as that. You acknowledge, yep, I've heard that as well. Number two, there was a lot of press around this in the early 2000s, and it really seems believable. You're acknowledging the apparent correctness. No one really knows what causes cancer, but chemicals are probably part of the problem, right? You're giving that olive branch. You're saying, I understand why this makes sense to you. Very non-judgmental. I'm down here with you. I've also heard this. It also feels correct. Okay? But you need to demonstrate why it's not adequate. Actually, though, the early studies that started this idea were conducted in a lab. Deodorant was applied directly to canine kidney cells in a petri dish, which isn't how deodorant is used in the real world. The cells were damaged, but the scientists weren't really sure which ingredient in deodorant was actually the cause. So we're kind of demonstrating why the belief that we hold isn't quite adequate enough. Now we replace it with a better understanding. There have been a lot of studies since then using a variety of different techniques, and none of them have strongly linked aluminum to any type of human cancer. Okay, so we're not telling them they're straight dope wrong and we're straight dope right. We're simply acknowledging that this current belief might not be adequate. And now we're bringing it home by demonstrating why our information is adequate. In fact, the American Cancer Society has stated that there is no reliable link between deodorant and cancer. They've even created a whole webpage that addresses this topic. Check it out. The link actually is down there on the slide. So we're walking people through, here's why this makes sense. Here's why it actually isn't the right or the best answer. Here's a better answer, which again might not be 100% correct, but it's better, it's more reliable. And here's why I trust that information. Okay? This can be hard to do, especially in the moment. But if you practice this, if you remember these steps, especially if you use this when you're creating like a press release, this is a better way to kind of slide that information in there without triggering that psychological reactance. I'll give you one more example on the process of eating undercooked pork. Eating raw pork is dangerous, right? We're all going to die if we eat raw pork. Raw pork is the most dangerous thing you could possibly do. Well, I tell you what, AI sure thinks so. I Googled raw pork. By the way, the Google AI generator is one of the worst out there. It consistently is wrong. I catch it all the time. And so it says, don't eat raw pork. You're all going to die because of trichinosis. There's so many parasites. Don't do it. Okay, well, this is a commonly held belief that raw pork contains trichinosis, which is a parasitic disease, and you will get sick if you eat them. Okay, we've all heard this. However, in European countries, particularly in Germany, raw pork sandwiches are eaten all the time. They're called Met, and a sandwich with it is called Metbrochen. I've had Metbrochen when I was in Munich. Not great, but it's there. It's available for you. It's a cultural delicacy. So wait a second. What the heck is going on? Why aren't they all getting trichinosis? Why isn't Germany rampant with trichinosis? Because here's the truth. Let's walk you through. Step number one. I've also heard that eating undercooked pork leads to trichinosis. This is a very commonly held belief. Yeah, eating undercooked pork leads to trichinosis. State the labia. Number two, it's true that raw pork and most raw meat can contain bacteria and parasites. That's totally true. We're demonstrating why this seems correct. You're not wrong. Number three, now let's bring in that inadequacy. But here's the deal. America has made huge strides in agricultural practices and food safety in the past 50 years. Trichinosis is exceedingly rare due to medicines that we feed the pigs, due to the way that we treat the meat during, if a pig is infected, we take them out of the herd. The number of trichinosis cases in the US has fallen 90% since 1982. Now, let's replace that information with some better information. You still probably should avoid raw pork, but even if it seems undercooked, it's probably safe. In fact, Germans enjoy it on sandwiches when the pork has been carefully processed and stored to avoid bacteria. Okay, here's a better idea. Don't go out and just gnaw on it every day, all day, but it probably won't kill you. And let's demonstrate the adequacy of that correct information. There's an average of 16 cases of trichinosis reported every year. Most of those are from bear meat. So there you go. If you're eating raw bear meat, you should probably be concerned about trichinosis. If you had a slightly undercooked pork chop at a restaurant, I probably wouldn't worry about it. Okay? So this is the process of taking a commonly held piece of misinformation. And again, that's misinformation. It's incorrect, but I don't think anyone's spreading that to be malicious, right? And here's a gentle way that we can avoid triggering that psychological reactance. We can get some better information in there. We can slide it in gently, and we can give people something to think about. Notice the word probably all over here. I'm not saying you're not going to get sick, dum-dums. I'm saying you should probably avoid raw pork, but I wouldn't worry, right? Think about that tone. Think about that calming tone to get people to think critically. We need to calm their fears in order to get them to think about these things, okay? So what we're going to do now is I'm going to have you practice it on your own. So I want you to think about all the things we just talked about, all the methods, all the different things that you can do, all the different ways that you can start to address misinformation. And I have a scenario here. So we're going to get into little groups on the Zoom chat, and we're going to try to work together to just develop a really quick response to this, okay? So here's the scenario. There's a rising number of people in your community that have started believing that chlorinated tap water is harmful. Specifically, they say that it contains toxins, such as heavy metals, and that chlorine causes developmental delays in children. They are expressing a desire to drink only bottled reverse osmosis filtered water. And you've also heard several people reference a brand called Safety 2O. Some have begun calling the city to request that it stop adding dangerous chemicals to the drinking water. So within your group, just brainstorm some ways. You don't have to come up with a whole communication plan, but think about, is there a short press release? Is there a social media post? Is there a message that you can get out there that could help react to this health mis or mal or is maybe disinformation? So think about what your main message is. Think about your tone. Think about your word choice. Think about your vocabulary. Think about whether or not you're going to offer any new information. Maybe now's the time. Maybe it's not, depending on how you're feeling. Think about where you might cite any sort of new studies or new sources. Will you do that? If so, how will you do that? Think about a quick message that you could relay to help sort of not necessarily fight this misinformation, but to get that message out there in a way that avoids triggering that psychological reactance. So that is your task. I tried to keep this up on the screen. When you get into your small groups, you will lose this screen, but I put this scenario on the Mentimeter. So if you're still in the Menti on your phone or on a website, if you click there, I just put it up there too. So you'll still have it to discuss. So Anna and Kayla, I'm gonna leave it to you to get our fine folks into some groups here.
Great. Before I send folks off to these breakout rooms, about how long do you want them to spend in their
Why
groups?
don't we take just like 10 minutes or
Okay.
so? Just again, you don't have to have a wild, multifaceted plan, but just think about, see if you can identify what's going on here. Think if you can think of creative, gentle ways to sort of get your message back in.
Great. Appreciate it. Okay.
Yeah.
I'm going to open up these rooms right now.
I am going to intentionally stay out of the rooms. I don't want to bias anyone or make anyone nervous. So I'm going to stay right here.
That sounds great. I will remain in here as well for the time being to help direct folks or reorganize if some rooms are light on attendees. And Missoula Public Health is joining us today as a group, so they're going to discuss among their group together.
Perfect. That's awesome.
Okay.
Oh, some rooms are really full. That's awesome. I'm going to run really quick and refill my water. I will be right back. I'm not
Sounds
abandoning
great.
you.
We'll see you soon.
is it just the fact that teens were already under distress for a variety of reasons?
Alrighty, we can probably pull people back. I want to make sure I have enough time for like a debrief and some questions too, if we have them.
That sounds great. I just broadcast that folks can return if their groups
Perfect.
are done, and they already are. So I think we're right on time. I'll
Perfect.
go ahead and close them up.
Great, thank you.
They have a minute to return, so we'll give them that time to get back in the main meeting. Okay. So all the breakout rooms have been closed and folks should be all returned.
Perfect. All right. So I know that wasn't a lot of time, and I know I've thrown a lot of information at you today, but we always learn best when we have a chance to kind of try out and play with the stuff that we're given. So if anyone wants to be brave and wants to share what they talked about in their group about a potential way to, a potential message that you could get out to the community to try to address this misinformation. I don't know if you want to maybe, what's the best way to do that, Anna? They could raise their hand or they could just go off mute and join us.
Yeah, either of those options sound great. If we all clamor to speak at once, then maybe raising hands, but otherwise, I would invite anyone to come off mute and share their thoughts.
Can you hear us?
We
Yes.
can. Hi, Missoula Public Health.
Awesome. Yeah. There's a group of about 12 of us from Missoula Public Health listening in together. And we definitely went through your rubric really quick of identifying what's true about what they're saying, what's false, some other things that we could throw in there. But one thing I want to highlight is that the health department does test water regularly. They work with folks that are on or off city water to see what's in their water, especially folks that are off city. They could have a lot of heavy metals, and we help them source different filters. I know your example has reverse osmosis, and that's something that we use. So I think in addition to all the points you gave us, kind of plugging in, this is a service that we already provide to the community. This is the data that we're already collecting, and this is how like we are integrating into this concern of yours because it's a concern of ours as well.
Yeah, and I like that last point too. I live in the community too. I'm also concerned about this. And as a department, we are tasked with being concerned about that. So, yeah, definitely building that sense of community and that sense of sameness and acknowledging, yeah, sometimes water is, not the most optimal. And so that's why we do this testing. Great job. Anyone else want to share some examples of messages?
So I'm part of Missoula Public Health, but I was in group 3, I think. And we were talking about this, what they were referring to as safety 2.0. So we thought we better look into that and see maybe what their campaign is to see what kind of information they're putting out.
Yes, absolutely. And that's key, right? Listen to your community. If you're starting to hear something over and over again, that's what's getting out there. So know what that is and know what they're selling so that you can have a better understanding of what is that GI Joe, knowledge is half the battle, right? If you know what's out there and you know what you're working with, you're going to have an easier time addressing that. Yeah, good call. I think
See Kelly's hand raised.
Kelly.
Hey, yeah, so we were group 5, and in addition to some of the things that other groups have already said, we wanted to make sure that we highlighted the safe level of like consuming chlorine in
Mhm.
water. Um, so acknowledging like, yeah, if there's like this much, not safe, but actually we're looking at this much. We talked about will you cite any sources or link to any info that we wanted to kind of summarize that, and then we would link to national or global organizations like CDC, DEQ, the World Health Organization, some of those more should be trusted resources. And then also that I just shared from a local health department perspective that I would love to like link us to it as well, as we have an environmental health division who does test the water. Like
Yeah.
Missouri Public Health was saying, and like if you want to talk to somebody locally, um, you can come and talk to us. And I think there was some discussion as well about, again, reinforcing like we test the water and here's kind of how we test the water, that type of thing too.
Yes, absolutely. We're also concerned about this, and this is what we're currently doing. And this is, I think that's great, adding that, being that advocate for science and saying, you're right, fluoride at, 6,000 parts per million can be dangerous, but we have 2 parts per million. So, adding some context there and helping with that science literacy. Great. Anyone else want to add anything?
The only thing that we talked about that people haven't already said is the idea of telling people why we put chlorine in the water in the first place. Like, how does it help us?
Sure.
So I think that could be like a good addition to the, not just it's below the level that could be harmful, but also we need it to reduce infections.
Yeah, absolutely. And that gets to that transformative explanation, right? Of like, I know you think fluoride is dangerous. I know you think the water is not safe, but not only is that inaccurate, and here's why, but actually the truth is we need some of those things, right? So like we are doing the testing, we are doing this for a very thoughtful reason, right? Yes, perfect. Yes. So there's no one right way to do this. And it feels very frustrating because this isn't necessarily going to convince everyone immediately, right? And that's the most frustrating part of being in a communication related job. Just listen to me and do the thing I'm telling you. But if you can kind of, again, sort of come at it consistently, be that voice in your community, be communicating about things before you think you need to communicate them, build that consistency, build that trust, because then when a crisis does happen, you're going to be better positioned to be that person that they want to listen to, or at least hear you out and put that into their bag of information as they're making these choices. So I wanted to leave you really quickly. We'll have a little bit of time for questions, but I want to just point out that it feels like we need to save the world because that's our job. But I do want to give you some breathing room here, right? It is okay sometimes to let things go. There are situations where you simply don't need to be the one debunking this misinformation. So think about when finding the resources to address that misinformation take more effort than the perceived benefit, right? Don't spend 3 weeks trying to build a lock solid argument against why people should be drinking tap water. You might convince 5 or 6 people, but it might not be that convincing, right? So really think about, what am I putting into this, and what is the benefit going to be coming out of it? It's especially interpersonally when we're talking to like friends and family, our temptation is to like spend hours going down a rabbit hole and finding all these studies, and it's like, is that the best way to do it, or should we just kind of maybe let it go because what am I really going to achieve? There's also times when misinformation is likely just going to debunk itself fairly quickly. This was an actual headline from the Wall Street Journal about a man named Eben Byers, who in the early 1900s, radiation was new and we were thinking of cool ways to use it. And a lot of people tried to make a lot of money off of it. And so he actually sold 400,000 bottles of radiated water for $1 each, which in the early 1900s was a fortune. The fad quickly died because a lot of people started dying. In the 1930s, this was his obituary or his headline about his death. He put himself in his home and he drank nothing but this radiation water, and his face literally collapsed from radiation. So sometimes this information is going to debunk itself, and you don't necessarily need to hasten that process. This was obviously an unfortunate outcome, but the fad came and went. Also, really think about, is the misinformation doing appreciable harm? if your mom wants to buy that $50 face cream with the activated charcoals because she believes it saps the toxins from her skin, that's probably fine. It's probably not worth getting into a huge family feud about it. I mean, at the end of the day, if a group of your community residents want to drink bottled water instead of tap water, and that's as far as they take it, that's okay. You don't necessarily need to make that your top priority because sometimes trying to talk people out of that misinformation, again, can create that psychological reactance. It can make people like you less and it can make people trust you less. So prioritize those relationships. And for those of you who work one-on-one with people, like providers or, people who have clients or patients, keeping that trust is the number one most important thing. So if someone comes to you and they're like, I'm only going to drink bottled water, great. Get down with your bad self. It's not really doing that much harm. We're not gonna lose that trust based on that. I also just want to point out too that it is not your job to save the universe. You have power and you can make an effort and you can make a dent, but this is not a one person problem, okay? And it will not have a one person solution. The solution to stopping misinformation comes from the legislative arm, from the technological arm, and from society. Okay. Misinformation existed long before we were alive, and it's going to exist long after we're gone. The FDA could control the supplement industry if they really made an effort to. We could create laws to require social media platforms to identify bots and AI. Some countries have enacted laws punishing people for the deliberate spread of health myths and disinformation. We could do any of those things. Okay, that's not in my control. It's not in your control. Researchers are also working to create automated fact checking programs, right? We're going to fight technology with technology. It's not your solid job to make sure that AI bots aren't taking over the world. And also, again, this is a social issue. We need to teach media literacy. We need to. And that's not something that you can necessarily do on your own one at a time. We need to put it into schools. There are countries that do this with school children. They have, literacy class as young as 5 or 6. They're taught to identify when someone is lying to you and when someone is trying to deceive you. So this is not just your problem to fix. I want you to take some of that pressure off of yourself. I know we're all passionate about this and you should be, and there's things that you can do, but please do not think that it is your job alone to save the world or to save your family members or to save the people that you love. Okay. This is a concerted effort that will take all of us. So I have a little bit of time right now for questions. I apologize. We ran a little bit longer than I wanted to, but I will also leave you with this. If you are interested in learning more about science misinformation or health misinformation, I personally recommend several of these books. The Misinformation Age, I actually use in my class. It's a great one. It's all about rumors and truths and misinformation of all kind, but these are some really other good ones as well. So, Anna, I'm not sure if we have just kind of some major questions that came through that I can kind of address for a lot of people or how you want to work that.
Yeah, let's see. And maybe Kayla can help me to bring any themes up to the surface. I do want to see if there's anyone with a question that wants to come off mute while they're still live here and ask while we pan through our. There was some comments early on about rurality and talking about some of the issues within rural communities that then once they come back they're not vetted in that community. So that is something that there was an early comment on.
Yeah. Yeah, and that's the trick too, right? A solution that works for one population or one culture might not translate to other populations or cultures, right? And we see that a lot of time with rural environments. We tend to take things that work in a suburban area and we just tack them onto rural areas, and that's not. Again, I'm a farm girl. I will tell you that those things don't always translate. So that's again, we're building that trust, and I'm one of you. Getting into that community, be visible, go to the events, right? Go become a part of that community, be a trusted member so that when you speak, it's coming from a place of I'm with you, not I'm over here telling you all what to do.
Some agreement in the chat about the importance of media literacy, also particularly in frontier rural areas.
Yes.
Catching them early. Any
Yeah,
other questions for the group here that we want to hop in while we still have Dr. Voorhees with us?
I have a question if it's just about if this has been recorded, how would we access it later for
Yeah,
review?
great question. Thanks, Eric. So this will go right back onto our website. So the Montana Public Health Training Center website, I can put the link in the chat. Once we clean it up and remove kind of our beginning wait time and the time with the breakout groups, then we'll get that recording posted back to our website. And I'll go ahead and put the link to our website in the chat.
awesome. I do want to just put in a plug here. If you want to contact me directly, there's my email address at University of Montana. If you're interested in some of my other work, there's my website right there. So if you have a question or a comment that you were dying to share, but are perhaps a little shy or ran out of time, by all means, come find me. I'm easy to find. But yay, if we have no further questions, I do just want to thank you so much. This topic is so important. And like I said, I don't have all of the answers, but hopefully I gave you something today that you can remember and you can take with you. And I thank you so much, Anna and Kayla, for being my technical assistants today and for running this for me. And hopefully this gave you a little bit of hope and a little bit of confidence as we go through. We can do this together, but it's not just our responsibility. So do what you can, give yourself some grace, take care of yourselves.
Wonderful closing message. Thanks again so much, Dr. Voorhees. Thank you all for joining us today. Return to our website in a few days for the recording link and feel free to share with others in your network. Thank you very much.
Thank you.